The October 22nd, 2024 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley is present. Ms. Bonnick. Ms. Bonnick is present. Mr. Brew.
Here.
Mr. Brew is present. Mr. Cruz. Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman.
Here.
Chairwoman Hasman is present. Mr. Milne. Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons. Ms. Vasquez Simmons is present.
Is there anyone signed up for the public forum?
No, there is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? Seeing none, the next item on the agenda is the approval of minutes. You have the September 24th, 2024 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk?
Referral 24-0327, authorize a contract with RRDA Ally Inc. to provide marketing services for the nurse aid training program of Monroe Community Hospital.
Moved by Legislator Vasquez Simmons. Seconded by Legislator Blankley. Oh, seconded by Legislator Smith. Is there any discussion? Yes, Legislator Milne.
Yes, through the chair, to the administration, were there other respondents to the RFP, and if so, who were they?
Is the mic on? There we go. Okay. Through the chair, there were 4 respondents: AMNY, BBGG, RRDA, and the third I.
And if I could, as a follow-up question through the chair, what was the determining factor in choosing the vendor that we chose?
There were several factors when we went through scoring. One of the things that stood out to us about RRDA was the blend of their deliverables that were favorable for the project.
Thank you very much. I yield the floor.
Anything further? Seeing none, all in favor, please signify by saying aye. Aye. Any opposed? Oh, one aye. All right, item carries. Next.
Referral 24-0328, authorize professional services contracts for the...
Oh, sorry.
Read back the ayes and nays for the last referral.
Yes, I can. Nine ayes, no nays.
We had
Nays.
one nay.
No,
No.
I think his was late.
Who was it? Was it A?
Oh,
Was
sorry,
an
I thought I
yes.
heard nay.
Thank you.
Yeah, it was just a little delayed.
Sorry. Sorry about that, Legislator Brew. All right, next item, please.
Referral 24-0328, authorize professional services contracts for the Monroe County Office of Mental Health Socio-Legal Center.
Moved by Legislator Vasquez Simmons and Legislator Cruz. Seconded by Legislator Blankley. Is there any discussion? Yes, Legislator Smith.
Thank you. Through the chair, around how many cases will these professionals evaluate per year?
Through the chair, can you repeat that question?
Yes. Around how many cases will these professionals evaluate per year?
That is going to be determined by the courts because the judge actually orders the competency exams.
Thank you. And I do have a follow-up question through the chair. Have we seen an increase in mental health issues that would require us to create these contracts?
Through the chair, yes, we have. And we have seen it statewide, not just in Monroe County.
Thank you. I yield the floor.
Anything further? Seeing none, all those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0332, authorize a contract with Family Counseling Service of the Finger Lakes, Inc. for problematic sexual behavior treatment services.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Is there any discussion? Yes, Legislator Dondorfer.
Madam President, through you to the administration, how many patients does this contract hope to treat and evaluate throughout the year?
Through the chair, Christine Durante from Probation. We don't have a number of people that this would actually treat. There is a shortage of therapists that work with this population. It's a youth population, youth with problematic sexual behaviors. So it would depend on how many youth came into contact with the justice system presenting with these issues.
And thank you, and I think you answered this question, but just in case you didn't, through the chair to the administration, so the criteria of that is being a sexual abused teenager, was it?
Through the chair, not sexually abused teenager necessarily. It's any youth that presents with problematic sexual behaviors. That means anyone who has been arrested for a sexually related offense, juvenile delinquency, or if it was a youth part case that gets brought down to family court or a youth part case.
Got it. Thank you very much. I yield the floor.
Further? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 24-0335, amend Resolution 109 of 2024 to increase the grant award from the New York State Office of Mental Health for the PFC Dwyer Veteran Peer-to-Peer Support Program.
Moved by Legislator Cruz and Legislator Vasquez Simmons. Seconded by Legislator Blankley. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 24-0338, confirmation of the appointment of the Commissioner of Public Health.
Moved by Legislator Vasquez Simmons, seconded by Legislator Cruz. Seconded by Legislator Blankley. Is there any discussion? Well, I have a question. We have well-documented health disparities and problems with social determinants of health in this county. I was wondering if Dr. Velez de Brown could talk about how the Public Health Department can play a role in addressing those issues.
Through the chair, there are many different social drivers or social issues that impact health, and so our department currently has programming addressing a number of them. So the first I will highlight is food insecurity. It's hard to be healthy if you don't have food. So Monroe County Department of Public Health currently manages the largest WIC provider in our county. We will continue to do that, and our staff are doing such a good job. Their caseloads are higher than the recommended number of cases per dietitian. They're also doing fantastic work with their peer breastfeeding counselors to help support women in a decision to breastfeed, make them aware of their legal right to express breast milk in the workplace, etc. So that's food insecurity. We also do have a lot of work, referring patients and clients that our various programs serve to other services, such as our DHS colleagues, to help address housing insecurity, those who are unhoused. So for example, our team that does outreach around the opioid epidemic, they are constantly offering connection to chemical dependency treatment, but also trying to help folks get connected to services that they might qualify for. If they run into a veteran, they're making connections to the Veterans Administration to help folks navigate sometimes the complex processes to apply for different services to which and benefits to which they are entitled. We don't necessarily have housing of our own within my department to address housing insecurity, but we certainly make plenty of referrals in that direction. And we're also, a lot of our staff sit at various tables that address things like poverty. Our team already is intimately involved in the Youth Behavioral Risk Survey, so we're working with our educational colleagues to help document teenage and behaviors around any number of behaviors, whether that's how much screen time, how much social media time, are kids wearing their seatbelts, are they drinking, smoking, engaging in any number of sexual activities. And so we're sharing that information with our educational colleagues so that that can inform the programming that they're doing to address any educational needs that those populations might have. So that's just a small part of what we do to address a number of those social drivers of health. But certainly, my intention is to expand that and be able to have our staff be at the tables where we're talking more about poverty, about the Food Council, other areas where we can bring a public lens to the conversation and also highlight where we know there are disparities and how can we support our community partners in directing resources to those that have the greatest need.
Just another question. What role do you think the Public Health Department plays in the mental health delivery of services, mental health crisis?
It could be varied through the chair. Our part could be varied. So we don't have the Office of Mental Health within my department either. However, we also make referrals to that division within county government. We can also provide and shine a light on data regarding, for example, in the opioid epidemic, who are the most highly impacted populations that are suffering disproportionate rates of overdoses or overdose deaths. And we can inform some of our treatment colleagues regarding the fact that older Black men are actually dying at a disproportionately high rate of overdoses. And so by providing that type of data, that type of information, then those partners can ensure that they're creating group services or make sure that they are trying to hire folks that might share some of those similar characteristics, and if nothing else, making sure that their programming is culturally tailored to not only that community, but linguistically appropriate treatment for Hispanic, Spanish-speaking only populations. And so we might not employ direct mental health, behavioral health providers, but we can certainly empower the rest of the community to make sure that they're doing the best work to reach those with the most need.
Thank you. Any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Are there any other matters to come before this committee? Seeing there being no other matters, the October 22nd, 2024 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, November 26th